What do you guys think is sort of the most promising area of research for ketogenic metabolic therapy right now, in your opinions? Dom, do you want to go first?
Yeah, well, I think it's the ketogenic diet. It's important to distinguish it from other diets because it is a medical therapy that has quite a history behind it. In some ways, it has kind of an infamous history, like for weight loss, for rapid weight loss, and also I think it has enormous application for glycemic control. So in many ways, I view that as kind of like a low-hanging fruit for getting people's weight under control and glycemic management under control. So we know it works really well for that, for insulin resistance. But I think my interest is really in the realm of neuroscience and the ability of a dietary therapy to change our metabolic physiology, which has profound effects on stabilizing brain energy metabolism, but also rebalancing in many ways neurotransmitter systems that are kind of out of whack and stabilizing neuronal circuits. And that could be through a bioenergetic standpoint, that could be through balancing GABA and glutamate, it could be suppressing inflammatory pathways. I'm a firm believer that systemic inflammation leads to neuroinflammation, and then this can be exacerbated or, really prominent in people who have like underlying infections. That could be everything from Lyme's disease to Epstein-Barr virus to cytomegalovirus to herpes simplex virus. I think these diets have tremendous application for that. And evidence for that is just, I've always gotten blood work, and maybe we'll talk about biomarkers later, but my CRP levels were always like 1 to 2. And since I've been on a low carb ketogenic diet, my HSCRP has been like non-detectable or 0.1 or 0.2. And I think, and I always used to use a lot of NSAID drugs because of training heavy and things like that. And I don't do that anymore. So I think the diet for me personally seems to suppress inflammation. So I think using it for inflammatory disorders and neurological disorders are areas that I'm very interested in, and I get a lot of feedback from people that send me emails. And
Yeah.
I have a hunch that's a great area of research. But inflammation applies to so many different, especially autoimmune disorders, which are rapidly on the rise too.
Yeah.
Yeah.
Yeah, definitely. I mean, I think I would echo Dom's thoughts on, this really being a powerful tool that we're going to see being very effective in many areas of neurological health. So, and in particular, I think for me, I'm really excited about the idea of preserving brain health in aging. I think that ketosis is a unique opportunity to really support the brain's function as we age, and in a novel way that maybe we've not yet found. So there's a lot of obviously conditions that happen with the brain when we age, and a lot of these dementias, for example. Of course, Alzheimer's disease is a classic and very prevalent one, but understanding that in these neurodegenerative conditions that are often age associated, you see this disruption in brain energy metabolism that is occurring kind of across the board. Like it's fascinating. I'm not really sure of many neurological or neurodegenerative diseases where they've looked at energy metabolism and it not be disrupted. And understanding that because of how the neurons function and how they really, unless you are inducing a state of ketosis, they're pretty, reliant on glucose as this primary fuel. But we also know, thanks to the work of some really incredible researchers like Stephen Cunane, that the brain gets worse and worse at metabolizing glucose as we age. And so having this unique opportunity to even just support the energetic needs of the brain as we age, with something like a dietary intervention, I think is going to really prove to be extremely useful. And when you're thinking about conditions perhaps such as like Alzheimer's disease, where unfortunately there's been a pretty significant failure of, at least to date, of pharmacological interventions for prevention or treatment of things like Alzheimer's disease, that makes this even more exciting, in my opinion, because it is something that is really has a lot of great science behind it and is something that's going to be feasible and attainable for a lot of people. And we have an aging population where it's going to be very relevant. So yeah, I think supporting brain health as we age is a really, really promising area of ketogenic metabolic therapy research.
Metabolic Health Summit is the world's premier scientific and medical conference on metabolic health and therapies, featuring world-renowned expert speakers, cutting-edge science, an innovative expo, and incredible networking opportunities. MHS is altogether an unforgettable experience for anyone interested in metabolic health.
I think Metabolic Health Summit is amazing. It does such a phenomenal job of bringing world-renowned experts in different illnesses and metabolism, real-world experiences, clinicians, patients, paired with vendors who are trying to make this easier for people. I think for everybody who comes, including myself, learns something.
Join us January 25th to 28th, 2024 in Clearwater Beach, Florida, or attend virtually. CMEs are available. Go to metabolichealthsummit.com and use the code LINK to save 10% on your registration.